Are there any benefits with going back in and having that type of injury and fixing kind of what was done, whatever it was, 5 or 6 years prior, right? We have new technology, right? We're always talking about new tech and new toys and things like that. And maybe it was something that whether the knee was going to eventually go or whatever case may be. But is there any benefit to going back in, kind of redoing what was done, taking out the old, putting in the new, getting the knee maybe even stronger, right? We think about re-injuring, and when I hear re-injure, I go, you're re-weakening something. But is there any positive that could come out of that?
So a lot. I mean, if you're concerned that there's going to be, remember the tunnels that we had before are no longer bone, right? They're tendon, so they never fill with bone again. So they can be windshield wipering. So if the tunnels are too big, or not perfect spots, or they've changed over time, you want to have that ACL at the exact spots, right? So it stops the knee from going forward. And so I do a lot of these revision situations. If it's not a situation where you're exactly happy with it, you want to redo the whole thing
Yeah.
because it's not very hard to redo. And with a guy like Nick Chubb, so like a standard athlete, 3 to 4 months is what I'd wait between the two surgeries. But understanding that like he can wear a special brace, they'll protect him from not injuring his ACL, but still let him work. Some of my patients, they don't always listen as well as someone like Nick Chubb would because they don't have all the resources, right? So I
Yeah.
worry the only
Yeah.
thing you worry about between those two times is does he injure himself because now he doesn't have an ACL, right? He had no ACL for almost 3 months.
That's
And so
wild.
that is, and you don't need it for walking. You don't even really need it for running. And a guy like him, I bet you that his exam would be hard to tell if he actually tore his ACL at the beginning because look at his legs. He can
Yeah.
overpower you. Like some of these guys, you can't even tell.
Yeah.
You need them to be sort of like almost paralyzed for a second before you can get the exam. We've talked about players like Hines Ward, right, for the Steelers. There's been players that have had no ACL and still been able to get away with it. So these guys are really strong. They can beat the system in certain respects. So like there's definitely an advantage to what they did. And they added new technology. I'm sure they added internal brace. I know voos is talking about the nanoscope that they use, the
Yeah.
special mini scope. That's an Arthrex product. They used the most cutting edge technology for him, and they probably used some things we haven't even heard of. Because they have everything there. Like I said, they're gonna pull out all expenses for the Cleveland Browns, and the with the hospital system that he got done at. So
I was going to ask you about that when you talked about the holes, if they would go internal brace or fertilize ACL or any of the other things that we've talked about before to maybe fill in some of those gaps to make it stronger and
uh,
for it to operate.
I
So,
bet they did everything. I bet they did everything. I mean, they're talking about the smaller scope they used. They probably used some sort of stem cell PRP option to help the ACL integrate. We
yeah,
talked about this with revision ACLs on our, you guys look back if you want to go see how this happens. We talked about this on our biologics and ACL surgeries,
yeah.
one of our more popular episodes. They did a lot of things to try to get him back faster. Now, again,